Welcome back to Medical Monday here on The Plus. I'm Casey Mason, joined tonight with Dr. Reddy, and we have some more callers on the phone line tonight. We're going to go ahead and talk to Lauren. Lauren, good evening. Can you hear us?
Yes.
Hi, Lauren. Thanks for calling in tonight. What would you like to talk with us about?
I just have a question. I had surgery on my back about 2 years ago, and my surgeon says there's really nothing else that he can do for me. I was just wondering if there's any other options other than surgery, something a little less invasive that's an option for my back pain.
Sure, Lauren. So anytime someone has back surgery, there's several options that we can use to treat them. We can still try things like epidural steroid injections. We do them slightly differently after you've had back surgery, and we can actually still try that treatment, the radiofrequency ablation, where we disrupt some of the nerves that are causing pain in the joints. It just really depends exactly what they did for the surgery, if they fused you completely or not. But one of the more kind of exciting therapies, it's really not a new therapy, it's been around since the 1960s, is spinal cord stimulation. Spinal cord stimulators were originally fairly similar to pacemakers, and that's kind of what I think of them as pacemakers for the spinal cord instead of the heart. But they use electrical energy to modify or adjust some of the pathways in the spinal cord. So when you think about how the body itself transmits information, it actually uses electrical energy. So these spinal cord stimulators have a battery pack and a couple of electrodes that we insert into the spinal column over the spinal cord itself. So that's within the bones of the spine and right above the spinal cord. And the battery pack is programmed a certain way to send electrical pulses several times a second. And there's two kind of modes of doing it, and some people will feel a little bit of tingling in their back and legs, but some patients feel nothing at all, and it really decreases the amount of pain. And it's not really pain like if you stub your toe that goes away, but it's that always there aching pain that patients have after back surgeries. The really great thing about something like a spinal cord stimulator is it is more invasive than some of the other procedures that we do, in that you're going to have something implanted in you, but it's a minimally invasive surgery, which is one benefit. And the second benefit is really that you get to try it first. So you don't get to try a back surgery per se. Once you have it, you kind of had it, and hopefully it went well. But the spinal cord stimulators, you actually get to do what's called a trial. So we put those electrodes in and we hook it up to a battery outside of your body. So we kind of tape it onto your back, and you go home with it and you test drive it. So if it helps significantly, which most of the ones that we do for an appropriately selected patient, patients are getting anywhere between 50 to 75% pain relief that we've seen. And they're usually asking me when I pull the leads out the following week, when can I get this device implanted in me? So it's been a really great option, and it's a way to kind of avoid some of the opioid use or minimize it as much as possible. And some patients feel that when they get something like a steroid injection, it helps for, you know, some patients say a few days, some patients say several months, but they want something really long term. And a spinal cord stimulator can often be the answer for that. So it's really exciting.
Yeah, great. Thank you so much for the call, Lauren. We appreciate that. And we also have Bill, I believe, here on line 1. You there, Bill?
I am.
Hi, Bill. Thanks for calling in tonight. What question do you have for us?
I have number 4 vertebrae is off to the left of number 5, and they're talking surgery. Is there anything else I can do besides that?
So it kind of depends what the imaging would look like. So it's generally kind of a forward or backward slippage, and it depends how much it's slipped off, and it also depends how much it's compressing either the nerves that are exiting out or the spinal cord that's kind of protected within those bones. If there's really severe compression of the nerves and you have something like weakness or loss of bowel or bladder control, then oftentimes surgery is really the only option. If the bones are just shifted somewhat and they're still stable and they're not moving off of each other when you bend backwards and forwards, then radiofrequency ablation is something that's a pretty good option for strictly the back pain itself. Radiofrequency ablation doesn't really help your leg pain if you have pain that goes down the legs, but it's probably one of the most effective treatments for back pain itself, more effective than epidural steroid injections typically. Whereas epidurals are really great for if you have inflammation around the nerves that are going into the legs, you can try to reduce some of that inflammation around the nerves. And if you just have arthritis from the shifting of the bones, sometimes we can do an injection into that joint where the two bones are kind of coming together at that L4 and L5 level. It's called a facet injection, so that's an option. But again, it really just depends on your imaging and how severe the symptoms are and how severe the compression of the nerves, if there is any compression of the nerves, is.
All right, looks like we have another caller here, Sam on line 2. Good evening, Sam. How are you?
Good evening.
Thank you for joining us. So what would you like to discuss tonight?
Thank you. I was just recently diagnosed with arthritis in my back. My question is this something that I would have to deal with long term, or will I be cured with medication?
So it depends, again, how severe it is, but for most patients that have arthritis, to some extent they're going to have to deal with it long term. You know, one of the most simple things that helps a lot of patients even before you get to medication is physical therapy. And it depends how you think about how it affects me long term. Physical therapy is important because what they really do is they give you a home exercise program when you go to physical therapy, and that's something that you do have to commit to doing really every day for the large percentage of the rest of your life. So yeah, you'll be affected in that you'll have to do those exercises maybe 30 minutes a day, 5 out of 7 days a week, but physical therapy alone with maybe a muscle relaxer or maybe some gabapentin for pain that goes down the legs is enough to control a lot of people's pain. So the goal when you come to pain management is not that you'll always be completely pain-free, but to really ensure that your life is as functional as it was before your pain. So we don't want you to always be thinking about, well, I can't do that because my back's going to hurt, or I don't want to do that because my back's going to hurt and I'm going to pay for it later. So we want you to do the things that you enjoyed doing before you had pain, and that's kind of the principal way that we look at, you know, treating pain, is getting you back to doing the things that you want to do and need to do. So you may deal with pain here and there, but I think with physical therapy and some kind of conservative medications, if your arthritis is fairly mild, you may be able to have a really functional life where it doesn't bother you all the time.
All right, great. You know, we appreciate those calls tonight. We really do. I hope we were able to help this evening. It's great that you call in here on our Medical Mondays. It's a really great show to hear free advice and expertise from a doctor. You know, doctor, we heard from both, important to note, both male and female tonight. A question I had for you, are men and women equally affected by back pain, or do you see it more in one gender opposed to the other?
Typically, if you look at the patient population that we have, it seems like women are slightly more affected by it, but in general it's fairly close. And it depends what the cause of the back pain is. When it comes to injury, you know, it's really chance of what happened to who. But when you look at kind of degenerative change, some people have jobs that, you know, they have a lot of wear and tear on their back, so they may be more affected by pain. But I think to answer the question, it's pretty close to 50-50 from what we see. I was curious about that.
You know, it kind of is situational. And also, just kind of talking genetically, back pain. What's your advice on that, or just keep an eye on something, for instance, scoliosis? Yeah. So right now, there's no genetic markers that we typically look for or screen for when it comes to chronic pain. But you know, I think in time, as pain management evolves, there's probably some genetic component to really all medical ailments these days. I don't know that it's, you know, a gene change that's going to cause you to have back pain, but are you more likely to have arthritis? A lot of times patients say everyone in my family has arthritis, so I think I'm more likely to have it, and they may have it, but at this point there's not specific genetic markers that we look for. Yeah, you know, we talk about men versus women, but here's another group of folks we may not think of when it comes to back pain or chronic pain. Kids. Really kind of ironic timing here. A lot of folks are sending their kids back to school as we speak, this week and next. What about back pain in children?
Yeah. So we don't treat as many kids at the practice I'm at now, but when I was in fellowship, we did treat children. A few of the things that we typically saw were backpacks that were too heavy, so that's something that should be a consideration. Obesity in children is also becoming a bigger problem these days, so that oftentimes was a big component of educating families on how to prevent back problems from being worse later. But typically kids don't have significant degenerative change in the spine. It's usually muscle spasm, things like that, so it's easier to fix, and kids tend to rebound a little bit better than adults do. So
I'd say so. Yeah. And do they still do regular school checks for scoliosis? I remember they did that, you know, regularly as a kid growing up when I went to school. And is that still something they implement?
They do.
That's great. Keep an eye out for that, because I think that early detection it's very important, I would assume.
Yeah, so a lot of times we see patients these days when in a time period where there was no screening, and it gets worse and worse, and you see them when their curvature is pretty severe, whereas now when they're screening kids, they notice the problem much sooner before you have things like really bad chronic pain or respiratory problems. So, you know, screening is definitely a beneficial thing, and you can intervene sooner rather than kind of later in life when there's a little bit more risk to some of the procedures.
Let's kind of dive into more serious side of diagnosis. It's very rare, but serious cases, they can include things like infections and tumors, in some cases kidney stones.
Yeah.
Dive into that subject just a little bit, what you would like folks to know about that as you're detecting it, and just some advice maybe if you do get diagnosed with that.
Yeah, so, you know, everybody thinks, the most common reason we see patients with back pain is typically from the spine, but we do see patients that have kidney stones and things like rheumatoid arthritis, more kind of rare things. So really when it comes down to it, it's keeping a really good recollection of exactly what your pain feels like and what makes it worse and what makes it better, because when you eventually see us, we actually use that information to really kind of correlate your story with what all the diagnoses could be. And if there's more alarming symptoms like weight loss, fevers and chills at night, loss of appetite, trouble with urination, then those are more alarming symptoms that you really want to see your doctor for. And even back pain that's really persistent, you know, that can be something that's more alarming than just kind of the routine arthritis. So if it's something that in your mind is bothering you, it's worth getting checked out rather than just kind of letting it go on and assuming it's just, you know, muscle strain.
Definitely, and you can go to the pain management group to get checked out. Well, we're going to go ahead and pause for another break. Keep it right here on The Plus. We'll be right back with more Medical Monday.